Do you know the most common medical diagnosis or medical condition in a pregnant patient?
Anemia?
Asthma.
Wow.
8 to 12% of pregnant females have asthma. It is the most common medical condition in pregnant.
Is that pre-existing or the development too? Does it involve
Both.
people who
It
develop?
incorporates both.
Amazing.
People who are pregnant.
I don't think that we do the best job to, manage asthma in pregnancy, and so I have no problem with referring, and co-managing with that. I do know for a fact that 30% of women who are asthmatic and pregnant, it can get worse.
Yeah.
With the pressure of the uterus getting bigger, pressing up against your diaphragm, and having that asthma, it can really feel like life-threatening. You're dying for breath. Yeah, asthma is just something where it can make someone even if you're not pregnant, you can go to a panic attack
And
because you're gasping for that air, your
and
food.
I always wanna make sure that OB-GYNs have the knowledge to manage asthma because as you said earlier, a lot of these women just are going to see you for those 9 months. They don't see really any other physician. And so having the ability to manage asthma, like I get text messages from all my OB-GYN friends like all the time.
Is it really mild intermittent?
Right? I mean, like,
I f
asthma's asthma. If you have it, you have it. If you got symptoms, I'm giving you more medicine,
Mhm.
right? So it's just and for pregnant patients, it's the same thing. Inhaled corticosteroid, short-acting beta agonist as relieving therapy, and then you're also gonna use inhaled corticosteroids on a daily basis. You're gonna use long-acting beta agonists on a daily basis. You're gonna use those 2 things in combination on a daily basis. If somebody has severe symptoms of asthma, you might have to step up to therapy to certain biologics. There's really only one that's been studied extensively, but it's just something that you have to think about and manage, right? I mean, it's just something that we have to continue to manage. You don't change it when they get pregnant. You keep them on the same things.
Right, I think that is the biggest question, and so most of the time, it's like 30, 30, 30. Like 30% can get worse,
Mhm.
but with that, of making sure that or wanting us to be comfortable with that, with asthma and pregnancy is that there is a 50% chance when a woman has asthma during pregnancy that her child will develop. And any parent knows that if you ever had a child that had asthma, it can be a scary thing. Okay. Especially, if you don't really know much about the disease because you just developed it during pregnancy. So OB-GYNs and, family medicine, internal medicine, like we need to educate the patients because, like I said, if you have asthma, 50% chance your child is going to have asthma.